We're excited to introduce Dr. Delia Chiaramonte, who will speak with us about keeping our brains healthy as we age. So GBMC is very proud to present Dr. Chiaramonte, who is the Director of Integrative Medicine at Gilchrist and the Division Chief of Integrative and Palliative Care at GBMC. Dr. Chiaramonte is board certified in family medicine and hospice and palliative medicine and is certified by the American Board of Integrative Holistic Medicine. She's an adjunct assistant professor at the University of Maryland School of Medicine Center for Integrative Medicine, where for nearly a decade she served as Associate Director and Director of Education. She has taught for the University of Maryland Baltimore Graduate School on the topics of palliative care and integrative medicine and has authored textbook chapters on integrating Chinese and Western medicine into cancer treatment, the integrative approach to pain management, and self-care for family members of intensive care unit patients. Her interests include integrative approaches to health and wellness, stress management, and self-care. It is our great pleasure tonight to welcome Dr. Delia Chiaramonte to present Keeping Your Brain Healthy as You Age. Dr. Chiaramonte, the floor is yours.
Thank you so much for having me. So there obviously are many parts to the brain, but the parts that I want to make sure that we talk about here today are these three things because they're relevant to what we want to keep, which is our memory and our ability to think and make decisions. And it's relevant to our fear regulation because calming that down helps our brain function better. So the three parts of the brain that I want you to know are the prefrontal cortex, which is this part right here. This is the executive function brain, the taking a test, making a decision, doing your taxes kind of brain. There's the amygdala, which is the fear regulation part of the brain. So when we're worried about something, our amygdala is going crazy. That's what happens in a panic attack, for example. And then the last part that's important is the hippocampus, which is the part of our brain in charge of memory. So when our hippocampus shrinks, our ability to remember things goes down. So we want our hippocampus to be big and robust. Stress, things that activate the amygdala, decrease the hippocampus. So we care about what's the amygdala doing for fear, what's the hippocampus doing for memory, and what's the prefrontal cortex doing in terms of our thinking ability. So what can go wrong? These are the things that can go wrong, the most common things. And one of the ones that I want to talk about, just because I think it gets missed sometimes, is injury, even smallish kind of concussions, which are not just for 12-year-old boys playing soccer and football players, right? If we stand up quickly and bang our head on the cabinet, you can have a concussion. If we fall down the stairs, even a couple stairs, or fall backwards and hit our head, we can have a concussion. People don't tend to use that word as often in people that look like me or you, and I'm not sure why. But it can cause changes in the way our brain functions, and there are things that we can do about it. So I do want you to think about, if you have even the kind of brain injury where you say, gosh, I hit my head and I felt kind of out of it for an hour, but they did a CAT scan and it was fine, that's a concussion. So what can go wrong? Injury can go wrong. Stress, which activates the amygdala and can turn down the function of the prefrontal cortex and turn down the hippocampus, meaning turn down our memory center. That is something that we can do something about, and we'll look at some evidence about what can happen there. Disuse, no one here, because you're all here learning stuff, but those that are sitting at home, disuse does change the way the brain functions. Time, of course, I have no solution for that whatsoever. Inflammation, which is inflammation that can come from all kinds of things, including some of the toxins that we're exposed to, but also some of our behaviors to do with stress and sleep, and also diet. So some of the things that we eat can impact inflammation in our whole body, including in our brain. And then free radical and oxidative damage from things like toxins, smoking, that kind of thing. Okay. So we talked about concussion. Just be aware that concussion really can change your brain, and there are some things that we can do about it, including things like brain therapy or vision therapy and neurofeedback, which I don't have time to talk about, but if you feel like this speaks to you, just email me, and I'll give you some more information. At the very end, you'll see my email. So not only injury, but stress is documented to be bad for the brain. So in mice, but also in humans, stress causes inflammation of the brain and it can cause increases in the amyloid, which is what happens in Alzheimer's. That's what we don't want. So even though it seems like, everyone's stressed, what's the difference? Literally, chronic stress causes changes in the brain that impact our long-term brain function. And chronic stress shrinks the hippocampus. And the hippocampus is responsible for what? Memory. Chronic stress shrinks the hippocampus. And the hippocampus is responsible for memory. So that's really important because we can't do much about the passage of time, but we can do something about years and years and years of stress. And even if you've had years before now, you still have years going forward. So it really does make a difference. I don't like this first bullet. I almost didn't put it in because it makes me sad to look at it, but I'm going to say it anyway, that higher midlife work stress was associated with a higher risk of cognitive impairment. But that doesn't mean that wherever you are, whether you've had midlife work stress or not, that you can't make a difference from now going forward. Because what we know is that stress impacts the way the neurons, which are the nerve cells, function, and it impacts neuroplasticity. And neuroplasticity is a fabulous thing. Neuroplasticity is the ability of our brains to continue to change and learn and grow even as we age. When I was in medical school, they taught us that there wasn't such a thing, that your brain grew until you were an adult and then it just was downhill from there and that was it. That's not true, it turns out. So it really does matter, even through all of our life, what we do with our brain, because we can increase connections, we can increase the health of our nerve cells, or we can do the opposite. We can decrease them. So neuroplasticity is not good if we're doing things that are bad for our brain, but it is very good if we do some things that are good for our brain. Don't do these things. Smoking, bad, 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 bad. Bad for your brain health, bad for so much of your health, as I'm sure you know, but it is also bad for brain health. It's associated with earlier cognitive impairment, Alzheimer's disease, and various dementias. So decreasing smoking is one of the number one things that you can do if you are a smoker to improve your brain health. Those foods, sorry. Luckily, the dinner you just ate is a very brain healthy dinner. I was happy to see that. So processed foods cause systemic inflammation, which is bad for us in all kinds of ways. But systemic inflammation includes brain inflammation. Brain inflammation is bad for the health of our brain cells. So chronic use of processed junk food is bad for our brain health. This we know, and we're going to talk about this. Use it or lose it. It is important to continue to use our brain, but there are particular ways that I'm going to tell you to use it. You'll see. Okay, this is what we talked about before, that our brain is continually reshaped by its environment. So what we do in terms of what it has to learn, what we use our brain for, but also the environment inside our body, shapes our nerve cells themselves. It shapes whether they live or die. It shapes whether new neurons grow, and it shapes the connections between them. So these things that connect different nerve cells are crucial. And when those little branches die, our brain function is not as good. And when we have more connections, it is better. So it's important to know that no matter where we are, we have some ability to change how fast it declines or even if we increase function a little bit. So I'm not going to talk much about different kinds of dementia because I want to talk about what we can do, not what goes wrong, but I did just want to touch on the most common dementia, which is Alzheimer's disease. And in Alzheimer's disease, what we see when we look under the microscope at the brains of people who have died are amyloid plaques and neurofibrillary tangles. So these are things that shouldn't be in the brain that are in the brain of people who have Alzheimer's disease. And what they find in brains of people who have Alzheimer's disease is a shrunken prefrontal cortex, which is in charge of what? Thinking, executive function and thinking, and the hippocampus, which is in charge of what? Memory. You remembered. Very good. Now, probably the most important thing about Alzheimer's disease for us to know is that there is a long, potentially 2-decade silent phase where we may be able to do something about it. So if we are doing things in that 20 years that decrease the function of our nerve cells, we may end up with a more severe dementia than if in those 20 years we make some of the changes that we're going to talk about today. So it's not like you get it or you don't, right? There are people who on autopsy have changes that look like Alzheimer's that never had a clinical dementia. And that's really important for us to know because it's not like, well, I got it, so that's it. This long preclinical phase is a place where we want to do something to maximize our brain health. And unfortunately, despite what the commercials will imply, we don't really have great medicines to prevent progression from the preclinical phase to Alzheimer's. They can slow it down some, but not a ton, and they don't stop it. So if we had great medicines that were easy to take, maybe we wouldn't have to talk about these other behavioral things. But since we don't, and we have evidence that we have some control over what we do to our brain, and in that 20 years it really makes a difference, it's worth us knowing what we have power over. So this is just to tell you that there is some researchers have tried to figure out, well, how do we know? Like, who's going to get it, who's not going to get it, who's at risk? So they came up with an index, and they looked at 9,000 people, 55 to 97 years old, and the 55 to 80-year-olds who had these risk factors, which are depression, interestingly, diabetes, low physical activity, high blood pressure, obesity, smoking, high cholesterol, heart disease, and moderate, meaning not small, more than a little alcohol use, had an increased risk of ending up with dementia. So, boy, knowing those two things, we have 20 years of preclinical time where we could make a difference, and the people who had uncontrolled these things were more likely to end up with dementia. It becomes pretty clear what are some of the things that we can do to make a difference in our outcome. It is interesting that it wasn't true in the people over 80. And maybe it's just that the people who are going to have really long lives were going to have really long lives. And maybe those people were genetically in a good place and not at risk, maybe. But none of us get a guarantee how long we're going to live. Okay, 9,000 people is a pretty impressive study. Okay. So that's the scary part. Now, what can we actually do? Calming your amygdala on a regular basis is really important. So the amygdala is in charge of what? Fear. Fear. The amygdala is in charge of fear. So whatever we call it, stress, worry, anxiety, fear, that's all the same thing. So when we are going in our head like, oh my God, what about this, and what about this, and what if this happens, and what if this comes back, and what if I don't get this, and what, right? And we're in this constant state of fear that impacts our whole body, including our brain. And chronic stress does what to the hippocampus? Shrinks it. And the hippocampus is in charge of what? Memory. Right. So chronic stress over years can impair memory. So that is something that we can do, right? And how can we do that? We can try to decrease the things that are stressful in our lives, but we can also do things that help manage stress, like breathing exercises, meditation, yoga class, exercise, getting rid of people we don't like or a job we don't like. I won't say a spouse you don't like, but maybe. But there is evidence that meditation is good for your brain. So there's evidence that meditation improves memory. So that seems weird. Why would meditation improve memory? Well, probably because chronic stress shrinks the hippocampus, and that impairs memory, right? So meditation, by the way, does not have to be something that you do cross-legged on the floor in a special outfit or anything. This could be something you do while you lay in bed. The concept of meditation, here's the most basic concept of meditation. You just focus on something. And when your mind wanders, which it will, because it has a lot to do, you just bring it back. So let's say you focus on your breathing. You're just noticing that you're breathing, because you are, there it is. And you say, okay, I'm going to focus on my breathing. And then your mind says, oh, I've got to take the dog to the vet. You just bring your attention back to your breathing. Oh, I've got to change the tires of my car. You just bring it back to your breathing. The downstairs is messy, I forgot to do the dishes. Just bring it back to your breathing. That is meditation. It could be breathing, it could be a candle, it could be a word, it could be your steps if you're walking. It could be a picture on the wall. It doesn't matter what it is. It's just putting your mind in the moment that you're in and quieting this thing. What about this, and what about this, and what about this, and I have to do this, and he said this. Anyone else do that besides me? It's just quieting that mind. Okay, so we have evidence that stress decreases memory. We have evidence that meditation, which is the opposite of the stress response, improves memory, improves IQ score, improves cognitive function. There's evidence that mindfulness meditation, which is just basically what I just talked to you about, which is focusing on your breathing, activates the prefrontal cortex. And the prefrontal cortex is in charge of what? Executive function. And it reduces amygdala activity. And amygdala is responsible for what? Fear. Right, so it activates the thinking part of the brain. That's the one we want, because that's the one that does stuff. And it decreases the fear part of the brain. Okay, so if you're using your breath for brain health, the simplest thing, couple things to know. One is, when you breathe up here in your chest, that's stress breathing. Shallow breathing. That is, no, we don't want that. How do babies breathe? Deep into their big bellies, right? So the kind of breathing that decreases the stress response is breathing that is deeper into your belly and slower with a slightly longer out breath than in breath. So, just like this. Just like that. So if you just laid in your bed and counted 5 breaths like that, that's already starting to teach your body what it's like to be in the relaxation response, not in the stress response. And we know all the benefits to that. Okay. So what else? Besides stress reduction, what else? You probably know this, but there's lots and lots of evidence about social engagement. More social engagement, for the most part, decreases dementia. Right? The only challenge is for introverts. My husband is a tremendous introvert, and he saw that and he said, no, because interacting with people causes stress, and you said that was bad. So it's interacting with people that you like, and if that's one person or your dog, that's fine too, but loneliness is the thing that worsens dementia. Exercise, 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 exercise. There is a ton of evidence for the benefits of exercise, specifically around brain function. So it improves brain plasticity, which we want, right? It improves blood flow to the brain, which you can imagine would be a good thing. It stimulates new nerve cell growth. That's what neurogenesis is. New nerve cell growth, which again, I was taught in med school, it doesn't happen, but it does. It stimulates new brain cell growth. It decreases inflammation in the brain. And it decreases these plaques, which I told you before, we see in Alzheimer's and don't want. And it increases the size of the hippocampus, which is in charge of what? Memory. So stress decreases the size of the hippocampus. Exercise increases the size of the hippocampus. Larger hippocampi are better at remembering things. So these are all good things. This I thought was really important. So the first study says people who do aerobic exercise have better cognition, better brain function. Okay, but you might say, well, maybe they're doing all kinds of other things too, because the people are exercising, they're not smoking, and they're not eating junk food, and maybe they're doing that, maybe it's all the things. Except they took people and randomly assigned them to exercise, and it still worked. So that, I think, is probably the most powerful study, because it took out all the other things that you might have been doing your whole life that were good and said whatever you were doing, the people that exercised had better memory and executive function than the people that didn't. So that's huge. Even in people with Alzheimer's disease. So remember, that's not even the 20 years before you got diagnosed where you might have a chance to change it. This is after you got a diagnosis. Exercise slowed decline. So that's remarkable too. And what that tells me is not just exercise is good, which is one piece of information, but also once people are diagnosed with Alzheimer's, we can do things that impact how quickly they decline, which is really great because our medicines are not very good at that. So why might that be? Because exercise was shown to make new nerve cells in the hippocampus, which is probably why the other study showed that the hippocampal volume got bigger, because it was making more nerve cells in the part of the brain that's in charge of memory. Regular exercise decreases our risk of developing dementia. In my mind, that is the number 1, 2, and 3 reason to exercise regularly. Not for weight control, yes, for cardiovascular health, but boy, nobody wants to lose their cognitive function. And it takes a while, so the earlier we start to exercise and the more regularly we exercise, the better. If you were going to pick one change to make after tonight, this would be the one that I would make. It has the most evidence for the most benefit in terms of decreasing the risk of dementia or slowing the decline if you already have dementia. So this is a study happening right now through the National Institute of Aging that is going to look at this very thing in a randomized way. So there's no answers yet. The end date is in July next year. But it's important. So for the National Institute of Aging to take on a large study to really look at something, that means they are very convinced by the evidence that has come through before them. Okay. Sorry. Apologize for this. I'm an everything in moderation person. I'm not saying never have sugar again, but it is worth knowing that there's some evidence that diets that are high in simple carbohydrates were associated with the kinds of changes that we see in the brain of people who have Alzheimer's disease. Probably because this kind of diet causes inflammation systemically, including in the brain, and we know that inflammation in the brain is associated with worse cognitive function. So how should we eat? Actually, how you guys just ate. I was really thrilled to see that that's what you just ate, which was vegetables, fish, healthy fats like in salmon, and low sugar diets. So anti-inflammatory kind of diet with these sorts of foods, lots and lots of vegetables, healthy fats, and healthy low-fat meats and not much sugar or processed stuff. That's the Mediterranean diet. That kind of eating is associated with better cognitive function. And it's not bad, right? The food's good. Didn't you have good food? Right? This is not a particularly restrictive way of eating. But this really is the way, if you want to know what can I do in terms of food for cognitive function, the Mediterranean diet is what you want to do. Okay. Fat in the brain helps us. So there aren't many supplements that have much evidence that is convincing. There's a lot of evidence for, one little study for this vitamin, one little study for this, one little study for this. So in trying to put this together, I could, if I were motivated to try to convince you to take supplements, I could make a slide that had lots of evidence for supplements, but they're on studies that are poorly done, that are small, that aren't replicated by other studies. So the things that are most convincing are fish oil, which is good from a cardiovascular perspective, good for preventing depression, but also is good for cognitive function, and vitamin D. So those two supplements, which I do take myself, fish oil and vitamin D, have by far the most evidence. That doesn't mean that other people don't take other supplements, they sometimes do, but the evidence is not as clear. CoQ10 maybe has some evidence, and if you feel like someone has dementia and you're trying to prevent progression. Vitamin C has a little bit of evidence, but not a whole lot. Resveratrol, which is in red wine, has a little bit of evidence, not a ton. But vitamin D and fish oil have pretty clear evidence. So if you were looking for supplements to take that had good evidence, those would be two you might consider. Sleep. Sleep is also important. Sleep is anti-inflammatory, so being sleep deprived is pro-inflammatory, which we already know is not so good. So sleep is important for stress management, for decreasing inflammation, and thus for cognitive function. I'm almost done. I know I'm almost out of time. Creativity, there's some evidence that doing creative things, even if you don't consider yourself a creative person, has some benefits in terms of improving brain connectivity. So remember we looked at that picture and it had not just the nerve cells but all the connections between them. That's what creative pursuits improve. Theater programs helped people with memory. And when they looked at creative activities and looked at what was happening in the brain with functional MRI, they saw increased activity in the prefrontal cortex, which is the thinking part of the brain. No surprise, there is some use it or lose it, but this, I think, is the thing that's important to know. What kind of use it are we talking about? So there's a lot of interest, I think, in these brain games, Lumosity and other kind of brain games, like if I do these, will they make me smarter? There's good and bad to it. Yes, people who did the brain games got better at the brain games. So if that's your goal, sure. But the problem was twofold. One, the getting better at the brain games didn't translate in being better at other life things, and when you stopped the brain games, the benefit went away, unfortunately. So I'm not sure how beneficial they are. They don't hurt you, but it's probably more important that you do other kinds of mentally stimulating activities. And this is, I think, what is most interesting. So they looked at people who were learning to juggle, which was hard, and they had increased gray matter, which is where some of the neurons are. But when they got good at it, like they practiced and practiced, so now it was easy, no more benefit. So what we need to do is not learn something and get really good at it and keep doing that thing. We have to keep learning new things. So if you're good at juggling, you have to now take up bridge. If you're good at bridge, you have to learn French, right? So the thing that seems to make a difference is continually learning new things. Which is good, because it's good for our soul and spirit anyway, don't you think? But that's why just doing brain games doesn't count, because it only makes you good at brain games, and then you lose the benefit, because once you get good at it, you're good at it, and it doesn't count anymore. So continual learning of new things. Okay, so I'm almost done. So big picture here, exercise stimulates more growth of the new baby neurons, the baby nerve cells. And then mental stimulation of new things seems to nurture them. So exercise and new learning all the time of different things is how we can use neuroplasticity to increase the function of our brain. I hope this doesn't offend anyone. My husband was a little offended. Cynical distrust was associated with dementia. Maybe that's about perception of stress. And if you are kind of a grumpy negative person and everything feels stressful to you, maybe that's a lifelong perception of stress, which is inflammatory, which is not good for your hippocampus, maybe, I don't know. But there may be some benefit to increasing your positivity and attitude. Okay, so here's the final slide. Practical plan, what can you do for brain health? Exercise, 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 exercise. Reduce your stress, either by, or both, by getting rid of the things in your life that are stressful, but also by actively stimulating the relaxation response. And if you want to know how to do that, you can contact me and we can talk about how to do that. Stimulate your mind with new and different things, and as soon as you get good at something, do something else. Stay connected with people, sleep, do some creative things, eat a Mediterranean diet, and if you feel like taking supplements, fish oil and vitamin D are your best bets. And I'm done. Thank you so much. Any questions for me? Yes?
How does the hippocampus control short-term versus long-term memory?
It's a great question, short-term versus long-term memory. They're actually stored in different parts of the hippocampus. And you may know that in dementia, long-term memory is often preserved. So people can tell you what their phone number was when they were in high school, but they can't remember what you talked about 5 minutes ago. But most of the hippocampus that we're talking about is dealing with short and medium-term memory.
If dementia is a process over 20 years of starting early, how and what is the test to know that you are starting at an early age?
That's a good question. And so the question is how, if it takes a long time to get to dementia, how would you know that you were in there and how do you get diagnosed, right?
Right.
So the first thing I have to say is there are different types of dementia, and that particular 20-year time span spoke to Alzheimer's mostly because there are much quicker kinds of dementia, more genetic kinds of dementia like frontotemporal dementia and dementia associated with other things like Parkinson's disease, which follow a different path. In real life, how do people get diagnosed? They often go to a neurologist. Most of the time, by the time people get diagnosed, they're much farther along than anyone in their family thinks because politeness is preserved. And so you can get along remarkably well just with the same stuff you've always said when your kids come to visit. I find in the hospital here, which is where I work, sometimes family members are shocked. They'll say, oh no, mom's pretty good. And I'll ask a question in front of them that no one has asked them lately, like, what's his name, your son? And they can't remember, they don't know. And people are shocked. So if you have a suspicion or a high risk, there are scales that your neurologist can use to help see, are you starting to have some early signs of dementia? So people can get diagnosed much more quickly than they often do.
What is the evidence for fish oil for depression?
What is the evidence for fish oil for depression? So there is quite strong evidence, placebo-controlled evidence, meaning they took people who were depressed and they gave half of them a fake pill that did not have fish oil in it and half of them pills that had fish oil. And the people who took the fish oil had decreased levels of depression. So fish oil is helpful for a bunch of things. Bless you. It's helpful for depression, it's helpful for brain health, it's helpful for cardiovascular health of various kinds, so heart attacks and strokes and that sort of thing. And also for nerve things like multiple sclerosis, some people can use fish oil, and also vitamin D. Yeah.
When you say fish oil, do you mean the omega-3 pill that you can...
Correct, omega-3 fatty acids.
Same difference.
Same thing, so it could be called omega-3s, it could be called fish oil, it could be called krill oil, that one's fine too. And let me tell you the one thing about fish oil that's important to know. The cheaper brands sometimes make you burp fish, and you'll never take it again. No one stays on those. But if you buy the brands that say no taste, that never happens. So if I were going to buy fish oil, I would definitely buy one that says no taste. And the ones that have no taste usually advertise that because they're more palatable to people. Yeah.
What effect does clinical depression have on memory?
That's a great question. What effect does clinical depression have on memory? So there's two answers to that. One is acute depression, meaning you're depressed right now, can absolutely make people look like they have dementia when they don't. Particularly older people over 65 or so. So there is that. Sometimes people get brought in and we think they have dementia, but we treat them for their depression and their memory comes back. So even in people who have dementia, they may have some dementia and some depression. If you don't treat their depression, their dementia looks worse. So in most people who have dementia, who have some sense that maybe they're depressed, meaning they're withdrawing from people, they don't seem to enjoy things anymore, their sleep is disrupted, they're crying a lot. Now these are all symptoms that can be just dementia, of course. But if you have those, it's probably worth a trial of an antidepressant to see if their dementia gets at least a little bit better. So that's an acute circumstance. But you may remember that in the LIBRA index, it also listed depression as one of the things that increases someone's risk long term. Now, why would that be? There's a lot of reasons that could be. I don't know the answer. But it could be things like, if you're depressed, you see things through very negative glasses, maybe that increases your stress. If you're depressed, you're less likely to do your regular exercise routine. You're less likely to make really healthy food and probably more likely to eat donuts. So it's probably behavioral along with the depression long term that impacts that. Yeah.
What is the role of hereditary?
The role of heredity in dementia?
Yeah.
Yeah, so there definitely is some, of course. And in certain kinds of dementia, genetics or heredity is more important. So in frontotemporal dementia, as I mentioned before, about a third at least of those are thought to be genetic. Early onset Alzheimer's disease has a pretty strong genetic component. So if your grandmother got Alzheimer's at 80, you don't have to worry that you have a high genetic predisposition. But if somebody got dementia at 45, then it's much more concerning. But let me tell you this. Epigenetics is a field that looks at how our genes are impacted by our environment. So the other thing I learned in medical school was that your genes are your genes and that's it. Turns out that's not true either, right? So we have genes that may give us a predisposition for something if that gene gets turned on. So maybe if we sleep terribly, we're stressed out all the time, we eat junky food, and then we're exposed to a whole bunch of toxins, that might turn on that gene, and now we have the, quote, genetic thing that we were predisposed to. But if we slept well, ate well, weren't stressed, didn't get exposed to those toxins, and that gene never got turned on, then we wouldn't end up getting it. So genetics put us in a certain direction, but they're not 100% that we're going to get something or not, most of the time. Yeah.
Did you imply that extensive age is a safety factor, that if you make it to 80 and there are no signs, you're home free?
That is what that suggested, isn't it? That was 9,000 people in that LIBRA index. That is what that suggested.
What is integrative oncology?
Great question. What is integrative oncology? So integrative medicine is the care of the mind, body, and spirit of the person and family using all the tools that work. So that might mean medication, surgery, procedures, acupuncture, massage, qigong, meditation, all kinds of things that work. So I offer integrative oncology consults here for anybody getting cancer care at GBMC. We have a new program, that's what I came here to start, offering integrative care to patients in the cancer center. But we also have changed our palliative care team. Here's some of my palliative care team. Tell them they're wonderful, because they're so wonderful. And palliative care is also the care of the mind, body, and spirit of the person and their family. And so we use all the tools that we have to take care of people who are going through serious conditions in the hospital. And outpatient, it's just cancer. In the hospital, it's everything. Yeah.
Dopamine, norepinephrine, neurotransmitters,
Mm-hmm.
ways to raise those naturally in your brain.
Sure.
Exercise.
Absolutely. So how do you raise dopamine and other helpful neurotransmitters? The feel-good chemicals, yes. Exercise, social connection with people you like, pleasurable activities, a way of processing things in the brain that is positive rather than negative.
That's fine.
Yeah, that's excellent.
Like golf.
Golf, which is connection, pleasurable, and exercise.
Yes.
So you get a triple benefit for that. Is that it? Okay, thank you very much. I really appreciate your attention. Thanks.
Dr. Chiaramonte, we have one more job for you. You got to come back up here and get your plaque.
Okay.
So I wanted to thank you very much for your time and perspective tonight and your wonderful presentation about and teaching us how to learn more about our own brains and how to take care of them. So thank you very much.
Thank you so much. I really appreciate it.